Hey everybody, welcome back to my YouTube channel. My name's Ashley Agan. I am a board certified ear, nose, and throat doctor. In this episode today, I want to talk about daycare as it relates to recurrent ear infections. Now, daycare is a known risk factor for kids who are having recurrent ear infections. And what I mean by that is that kids who are in daycare are much more likely to experience multiple and recurrent ear infections compared to those who are not. And this has been shown consistently throughout studies over time. Now, a lot of this is because when kids are exposed to other kids, they're going to pass around whatever the virus of the month, so to speak. And because they are still developing their immune systems, they are going to be more susceptible to catch whatever upper respiratory infection is going around. And so if you have lots of little kids in a small space inside, and if you have small kids, you know that they can be pretty disgusting. They are constantly touching the floor and each other and putting their hands in their mouth and their nose. So the transmission of viruses is almost impossible to control when you have a bunch of small children together. The common pattern is that it starts with a runny nose or a cough, and then maybe days later turns into an ear infection. And that's when you'll really see an increase in fussiness. That may be when the fever kicks in, and that's when they're not sleeping through the night. And you take them to the pediatrician or urgent care, and they take a look in their ear and they say, oh, yep, it looks like they have an ear infection. So we know that kids who are in daycare have this increased risk for recurrent infection. But not all kids who are in daycare are experiencing this, by the way. Now, one thought, because we know this is a potential modifiable risk factor, if your child is in daycare and is experiencing recurrent ear infections, you might consider taking them out of daycare if you have that option. For me, for example, my child was in daycare. She did experience recurrent ear infections. She did ultimately require placement of ear tubes. But for us, taking her out of daycare was not an option. We intentionally chose daycare over, for example, nanny or one of us staying home. Those were just not options for us for multiple reasons. And so we intentionally wanted our child to be in daycare. And so to say, oh, we'll just take them out of daycare for the next year so that they're not having recurrent ear infections, that wasn't really an option for us. If you are in a situation where that is an option for you, then that's certainly something that you could consider. And in fact, we do have multiple studies that looked at what taking children out of daycare does. And the reason we know that is because in 2020, schools and daycares were shut down all over the world. And so now we have studies looking at what happened during that time period. And there was a significant decrease in recurrent ear infections. As an ENT doctor, I remember our pediatric cases plummeted. Kids did not need ear tubes because they were not getting the number of recurrent infections that they had the month before. Once things shut down, it essentially solved the problem. Obviously, that's not a good long-term plan for everyone, but I think that we have evidence that removing children from the recurrent exposure can help get them out of that cycle of recurrent ear infection. And if you are particularly concerned about your child maybe needing ear tubes and that is an option for you, then I think by all means, try that out. See if removing them from that recurrent exposure is helpful. All that to say, there are also children who are not in daycare who also experience recurrent ear infections. So it's not like there is one thing that is the cause and that removing them from that is going to cure everything. For small children who are developing their immune system, it can be normal to have an upper respiratory infection, meaning runny nose, snotty, nasal congestion, cough, anything infection that's in the upper airways once every other month or so. So 6 or 7 infections a year can be normal, which is a lot. If you think about how long it lasts and how long it takes for them to get back to baseline, it's just in time for them to get sick again. So the children who are very young, it can be normal for them to have a period of time where they just have a lot of snottiness and congestion, and that can turn into ear infections. And being around lots of other small children who are also snotty and experiencing viral infections increases the risk of your child having recurrent ear infections. So if you're in that situation and you're thinking, what else could I be doing to potentially decrease the risk of recurrent infections? You might consider, is that possible for you? I've had patients who have family members who are able to step in and take care of their kids for a little while to take a holiday from daycare. By all means, if you might just find ways to get creative, I would love to hear your thoughts. Drop comments below on things that you've tried that have helped as far as being able to decrease your child's exposure to viruses from other kids.